Hey guys, good evening. Welcome back to our next episode of Reason with Steff. So it's been a long time. We have not done any reasoning, and I decided to do a little reasoning this evening. And this evening, my topic is we're talking about the system of the hospital, the system of customer service on a whole, the system of how we know when it's an emergency. Um, and what strikes me the most this evening, I'm not just going to talk about one hospital, I'm going to talk about all hospitals in Jamaica on a whole. I want you to give me your feedback on when you go to the hospital, how they dealt with you, how quickly you're dealt with there, um, what you think about the system there, how can we improve on the system, so we are not just going to tear it down, we are going to try and build it and give them our feedback and what we think is happening and what we think is supposed to change. All right, so when we come back, let us think about it, and we are going to be talking about this system right back after the break. So welcome back, guys, and so this evening we are looking at the hospital system, as I said before, and what is the service like when you have gone there to take a patient, or you as a patient have been there. Now, let me first talk about emergency. What do we classify as emergency here in Jamaica? And emergency, when we say emergency, I think it's something of an immediate effect. So if you are sick and it isn't an emergency, somebody should be paying attention to you right then and there, because you're coming as an emergency. Now I've gone to a certain hospital, and when you you go to the hospital, I don't know if every hospital operate this way, and when you've gone to that hospital, before, even if it's an emergency, before you can go in with your emergency situation, if you don't know what is happening at the hospital and you go, you have to stop at the security post, and when you go to the security post, they are sending you back to a customer service post where you have to register yourself or the patient before you are looked after, before anybody at all can see you. All right, that's number one. So if you come in as an emergency case, then I don't see that as an emergency, because you have to stop at so many posts before you actually go inside for any doctor or anybody at all to look at you. And when you go inside for somebody to look at you, eventually you log your name, you have to wait for them to call you, because they log your name and apparently others were there before you. Or if persons use their conscience, but from what I have observed, if the security uses conscience and see that the person that comes in is really sick, he will go against what they tell him and send the person. But in sending in the person, is there anybody to look at the person? No. An emergency is classified as being immediate. So you go in for an emergency situation, you're really sick, you're having terrible pain, you faint, and you're going for an emergency situation. The first thing of so many stops can cause you to lose your life. The next thing of not seeing a person, a doctor, a nurse immediately can cost your life. All right. So I take persons to the hospital more than one occasion, more than two occasions, more than three, and the emergency situation is that you take them in to the hospital. The hospital supposed to be looking at them immediately or having somebody tending to them immediately, but you don't see where that happen at the hospitals any at all. All right, now you go in as an emergency case or even not an emergency case. Then let us classify you as not being an emergency case, and when you go there you wait for hours to see a nurse to take your vitals, to do your vitals. So they do your blood pressure check, they do your diabetes check, they do your temperature and all those things. If you are to do a urine test and so on, they will do it. Now sometimes you have to wait for hours before there is a nurse at the post that will do all those vitals. If those vitals are not done, you can't see the doctor. All right? Remember, we're talking about an emergency situation and a non-emergency situation. I'm seeing all of those situations treated the same way. They are treated the same way. Now let us talk some more. And I want you to give me your feedback on what you think. How this is supposed to go. No, you go into the hospital and the waiting time there all day. And mine, I'm not saying you're not looked after, and they don't look after you, but the amount of time that they take to do all of those things can cost a life. It can cost a life. No. After you go in and you see the nurse, you see the first doctor, you still have to go back outside to wait for the doctor to call you again. And you see the first doctor. Yes. And the first doctor prescribed that you get some medication immediately. This is the next challenge that I see. When you go to the medication room for that treatment, there is nobody, no nurse to administer the treatment. No nurse. And then remember, you're in pain and you're waiting there for hours. Not half hour, or 15 minutes, 1 hour, hour and a half, 2 hours before somebody comes into that treatment room to administer your treatment. Tell me now, as serious as that is, you pass away, don't it? As serious as that is, you have to wait for hours. A lot of hours I'm talking about, before they administer the medication that is being prescribed. Sometimes the long wait, your docket come around, you register, your docket come around, and there is a next doctor calling you and you still not get the medication that the first doctor had prescribed for you to receive at the hospital. Huh? Come on. What kind of system do we have here in Jamaica? Is it a good hospital system or a bad one? I think the government and the stakeholders of the hospital need to look into the system. They need to make a change into the system. I mean, I'm not saying, that the nurses are not short-staffed, or doctors might not be short-staffed, or whatsoever. But have things in place. Have things in place so that when you go to the hospital, even as an emergency case, you must have things in place that patients are looked after in a timely manner. You go there, and because you are posted at the area as a nurse or as a doctor, you can't move from that area to just administer little medication to somebody else that is dying. Where is the care when you went into the system? You went into it as being caring. You went into the system, yes, to earn, because everybody needs to be paid when they work. However, where's the care? Where's the care for others? Where's the care for human beings? We don't have any care, because we are thinking that yes, we are overworked, yes, we are tired, yes, however, care must be shown for persons. We are not hog and goats and dog, and even hog and goats and dog have persons who care for them. The system needs to revamp. A change is needed there. The system where you have to, when you go in, you have to stop at so many posts before you see somebody that is supposed to be caring for you, need to revamp. You must be able to walk in and a doctor sees you and say, all right, the patient, they look like you can go register the patient before somebody, the vitals is done. An emergency must be stated as an emergency. Security don't know what is an emergency because they don't even know what you're feeling. Customer service don't know what you're feeling either. And that is what we are looking at. Changes need to be made in the systems of the hospital. We need to have changes. We need to have change. Change need to be there. That's the system we are talking about. That's the customer service we are talking about. When you are sick, When you are sick, you're sick. And if persons are feeling pain and you're going to tell them that a little pain, come on. Have you ever feel some pain? Persons going there, they have to see you dead first before they run up and down to state that it is an emergency. You're sitting out there all day and waiting, but until somebody kin over, let us not say faint or that. Let me say then kin over, drop dead. Before you see people run up and down, nurses and doctors running up and down, like they lose their tails when you go into the hospitals. Changes, Minister of Health, Nurses Commission, you need some changes in the hospital. So if it is more workers we want, get them and put there, that patients can be comfortable and look after in a timely manner when they've gone to the hospital. Now, if you are giving us free health care and you are shortchanging us, tell us what we are to do. Persons might as well stay home if we are going to go there and wait so long. all day, and at the end of the day, you still don't get medication. Hmm? There is no system that can run like that. I sincerely hope that you hear my voice, you hear me talking, and you make some changes to the situation. We can't continue, we cannot continue like this. There must be a change. There must be a change. I want you to listen to me. I want you to hear my voice. And I want others to voice their opinion. I am disgruntled. And I know others are disgruntled. And persons are afraid to talk up. People, you need to speak up. You need to speak up when there is something troubling you in the system. You can't have a system where persons are waiting on medication and nurses and doctors are on their phone and have no care in the world. You can't have a system where persons are doing their own thing. It will not work. And I am not going to rest until I see some change in the system. I'm calling on you, ministers. Help us to make Jamaica a better place. I leave this positivity in your hand. The things you do today will come back to haunt you tomorrow. The things you do today, it will come back to haunt you tomorrow. If you take care of me, tomorrow somebody else will take care of you. If you ill-treat me, tomorrow somebody else will ill-treat you. Do good and good will follow you. Walk good